10 Investigates found nearly 200 nursing homes across the state cited for failing to control the spread of COVID-19. Later got bonus payments from the federal government worth millions. This news not sitting well with people who lost loved ones or a nursing home watchdog who says the payments failed to hold these facilities accountable. Here's Chief Investigative Reporter David Haverly.
And when you put somebody in a facility like that, you're expecting to be provided good care.
Stephen Short described his late uncle as a businessman who gave back. Harry Robert Evans is also one of more than 7,500 long-term care residents in Ohio who died after contracting COVID-19. His death in August came during a stay at Newark Care and Rehabilitation. An outbreak here led to Stephen's outrage.
Oh, absolutely. I mean, he was a good man. And after him, he's the after his death, I have my mother left on that side, and that's it. So, so it's a hard thing.
It's not entirely clear who infected the 85-year-old, but the facility was later cited by the Centers for Medicare and Medicaid Services for inadequate infection control. During an August survey, health inspectors wrote that based on CDC guidance, the facility failed to perform adequate contact tracing to properly identify, quarantine, and appropriately test all residents with known exposure to a staff member who tested positive for COVID-19. Inspectors also noted that the facility's failure likely contributed to the COVID-19 outbreak that spread throughout the facility, infecting 71 residents, resulting in 20 deaths. CMS hit Newark Care and Rehab with a $459,000 civil monetary penalty, but in the months that followed, the federal government also awarded that same facility another $153,000 in incentive payments when COVID cases went down.
It's unbelievable because, how does the federal government, incentivize somebody like that and help them out?
It didn't just happen here. This facility and this one, all of which were cited for infection control issues, later got bonus payments from the federal government as part of a $2 billion portion of the CARES Act. The monies were rewarded to nursing homes and long-term care facilities that showed improvement in cases and infections during a given month, regardless of what happened in previous months. In fact, 10 Investigates found of the 247 facilities in Ohio cited for infection control issues, 195 of them also got these bonus incentive payments. And in 80% of those cases, the amount of money from the bonus payments completely covered the cost of the civil monetary penalties.
Really, those monies are from us. These are taxpayer subsidized dollars. They are being given right back to the nursing homes.
Brian Lee is a former nursing home regulator who now runs a patient advocacy nonprofit. He says the federal government's incentive payments fail to hold these facilities to account for their missteps.
If you take a deep breath and smell dead bodies are piling up in those other waves of outbreaks, it's like the feds just neglected all of that and had the blinders on just to look at what was going good at a good period.
But a spokesman for the Ohio Healthcare Association, which represents 1,100 long-term care providers, acknowledged the payments weren't based on past issues.
It's not looking at, did you improve your infection control practices, at least not directly.
Mm-hmm. But the optics of all of this just seems goofy to some people at home, I would imagine.
Yeah, it's been pointed out.
I've left several messages.
Newark Care and Rehab hasn't returned our repeated calls seeking comment, and a former administrator declined to be interviewed. We did hear from Country Court in Mount Vernon and Otterbein at Gehanna, both of which received infection control fines and bonus payments. They each sent us separate statements that included very similar phrases, including this one, quote, "Survey history and/or receipt of isolated deficiencies that may have occurred should not be the basis for denying critical resources for any provider or nursing home resident. But for family members like Stephen, still grieving a loss, he disagrees."
Nothing's going to bring him back, but again, when you blatantly do things that cause people to lose their lives, you shouldn't receive anything.
Bennett Haberly, 10 Investigates.
Now to search which nursing homes got incentive payments and fines in your area, look for this story on our website at 10tv.com.